What's going on, everyone? Welcome back to the channel. My name's Vincent Esposito, and today we're going to be talking about ADHD, or Attention Deficit Hyperactivity Disorder. But before we get into it today, please subscribe to the channel if you haven't already. Coming out with new videos twice a week on everything from health, nutrition, longevity, lifestyle going forward. So if you're interested in that, stick around, you might learn something. So ADHD has become a more growing issue in the last few decades, I'd say. And a 2016 study actually found that there are 6.1 million Americans between the ages of 2 and 17 that have an ADHD diagnosis. And again, that doesn't even count the adults. So this is really a growing problem, and the need for more natural strategies to manage ADHD are becoming more important than ever. Now, ADHD is defined as a neurodevelopmental disorder that consists of a variety of symptoms, including things like the inability to focus or concentrate, hyperactivity, inattention, poor organizational skills, poor time management, restlessness, poor behavior with others, especially this is more common in children, impulsive actions, frequent interruptions, speaking out of turn, and even fidgeting. And there's a few more, the list goes on. Interestingly, those who have been diagnosed with an ADHD diagnosis are more likely to have a comorbidity like anxiety or depression, bipolar disorder, Tourette's syndrome, and even substance abuse issues going forward in life. There are some environmental factors that play a role in likelihood of getting ADHD, and I want to go over those quickly. Things like this include exposure to drugs or alcohol during pregnancy, low birth weight, gender, because males are more prone to be diagnosed with ADHD than females are, a lack of oxygen at birth, or exposure to toxins at birth or during the early developmental years. These are all factors that play a role in increasing the likelihood of an ADHD diagnosis early in childhood or down the road. The standard treatment for ADHD usually includes some sort of drug. Usually it's Ritalin, Adderall, things of that nature, psychotherapy, or a combination of both. Interestingly, children and adults with ADHD tend to suffer from insomnia and have some sort of sleep issues or sleep disturbances more so than the regular population, by a factor of 25 to 50% higher than the normal population. The insomnia in those with ADHD is usually attributed to a disrupted circadian rhythm and melatonin cycle release. However, interestingly, those who are on stimulants like Adderall and Ritalin tend to be twice as likely, even among ADHD patients, to have some sort of insomnia or sleep disturbances versus those who are not on them. And this is the reason why we need to look for some more natural strategies to help with some of those ADHD symptoms. So one of the first ones that's really key is actually food intolerances and getting rid of any sort of food sensitivities and allergies that might be playing a role. Especially for those with ADHD, going through an elimination diet, an elimination protocol, especially for at least a month to 6 weeks, is really key, and it will help alleviate some of those symptoms. More importantly, it may help you identify and eventually remove some of those trigger foods that could be exacerbating some of those symptoms. Some of the common foods that are eliminated on a standard elimination diet include things like gluten, dairy, GMO soy, eggs, added sugars, and even some nuts, depending on how intense you want to get with it. After you remove these foods for about 6 weeks, you can slowly introduce or reintroduce one at a time and monitor kind of your behavior or see if there's any changes over the next 3 days. And then you can kind of go from there. So if symptoms increase, you tend to know, hey, that food's a trigger. And now you know that going forward and could eliminate it for the long term. In addition to an elimination diet, getting the proper fats in, so omega-3s, you want to also look at things like healthier oils, things like avocado oil, olive oil, coconut oil. These are also going to be helpful in terms of creating a healthier environment to improve some of these symptoms. Also, you want to be getting at least somewhere between 5 to 7 servings of just green leafy vegetables per day, and you want to get ideally 10 plus servings of total vegetables and fruits per day. Getting on a regular exercise and physical activity regimen is also really key, as those seem to help mitigate ADHD symptoms or at least lessen them. So doing some sort of regular physical activity is really key. It could be anything from playing a sport to simply going for a run to even less intense things like yoga, meditation, and Tai Chi. But physically getting active and doing that will help mitigate some of those ADHD symptoms, and it's really important to get started on one of those. Another key I alluded to earlier is addressing any sleep issues. Now that may be as simple as understanding what's going on with potential prescription medications. It could be as simple as regulating a sleep cycle, and I will link my sleep video above here, and getting that correct distribution of cortisol, melatonin levels so that we are getting to sleep consistently at the right times and waking up and getting proper amounts of quality sleep. Now, all these are key in helping to mitigate some of those ADHD symptoms. Finally, there are a couple of supplements that could be useful for helping mitigate ADHD symptoms. A broad spectrum multivitamin, multimineral formula can be useful for mitigating some and decreasing some of those ADHD symptoms and improving mood. If you happen to be magnesium deficient, having a magnesium supplement can really help improve cognitive performance and improve mood overall. Normalizing that omega-3, omega-6 fatty acid ratio will also help improve mood and cognitive function. So whether it's taking a supplement while simultaneously removing some of the omega-6s from your diet will be really key into helping mitigate some of those symptoms. Finally, zinc sulfate, especially in children, has been shown to help reduce some of the symptoms of hyperactivity and improve cognitive function as well. So I hope you found this information helpful today. Again, if you did, please like and subscribe below and leave any comments if you're interested in learning more or left something out. Love to hear from you guys. And until next time, take care.